Hi there, I'm Dr. Stephen Fallon. Welcome to this new video. And for this video, I'd like to continue my series of product recommendation videos. And this particular video is going to talk about a system that I use with the Kavo Sonic Flex Scaler and a series of specialized tips to ultrasonically prepare tooth structure. So this has the advantage of being able to really predictably prepare tooth structure in a very controlled and predictable manner without a lot of trauma to soft tissue, etc., surrounding tissue. And you'll see with these tips what I'm talking about. And if you look here, here's one example of some of the tips that we use. And this tip I've talked about before. It's an ultrasonic veneer preparation tip. And basically what this has is it has a flat side with no diamond dusting on it, and the other side is the preparation side. So if you're wanting to prepare interproximal margin but not break the contact and not touch the adjacent tooth structure, this is a very good diamond because you can go up to the adjacent tooth with the flat side that's not prepared, so that doesn't have any diamonds on it, and you can go right next to the prepared tooth, even touch the tooth with this side of the instrument, and you won't damage the tooth structure because it doesn't cut. And so this gives me a very precise marginal finish in tight areas. And then the next series of tips that I use are these ultrasonic inlay-onlay preparation tips. The ones that I use are the gold system and the ceramic system. And both of them work really well. The nice thing about these as well, they have a safe side. So the safe side prevents you from touching the adjacent tooth if you're preparing a class 2 type of slot and there is an adjacent tooth next to the tooth that you're preparing that's not going to be prepared at that time. So I actually use these for pretty much all of my class 2 direct resin slots as well, because basically, especially if the case has a virgin tooth that has interproximal decay in the class 2 area, if there's interproximal class 2 decay, I'll prepare the tooth a little bit with a diamond, but I won't break the contact. I'll get the decay mostly out. I'll thin out the portion of the tooth that we're preparing. I'll thin out the proximal area, but I won't break the contact. And then I'll go in with this sonic tip and break the contact with the sonic tip with the flat surface facing the adjacent tooth that I don't want to nick or touch or damage in any way. So this allows me to prepare my slot or finalize and detail my slot for my class 2 resin without damaging, as I said, the adjacent tooth. And if your slot is going to be smaller than this instrument, they have some smaller sized versions of these types of instruments as well that you can use. So I found this very handy with class 2 direct resin. It's excellent with onlay preps, because with onlay preps, or inlay preps actually, because an onlay prep covers most of the top surface of the tooth, an inlay slot type of prep, this gives you the correct geometry. It makes all your margins nice and clean and precise, and just the finish of the margin really precise and, what's the word I'm looking for, very geometrically shaped, but also smooth. Smooth is the word I was looking for there. And if you look at this picture taken from the Kavo website, you know, this is what I'm talking about. You put the tip in, you have a safe side that will not damage the adjacent tooth, and that's the beauty of this system, and why I use it just for direct resin as well as inlay, onlay type of preparations. And then here's the Kavo website. I'll actually give you a link below this video to this particular page on the website with the Sonic Flex tips, the minimally invasive dentistry tips. And there's some PDFs that you can download from this page which are really helpful about the technique. So we'll put all of those links below this video on my blog. If you're watching this on YouTube, you can click on FallonDentalSeminars.com, go to my blog, and you'll be able to get all the downloadable information. So here's the other tip that I'm using. And this is an ultrasonic chamfer margin preparation tip. These are not from Kevo, they're from Comet, a German company. And basically they're designed to be like almost like a cylinder, round-ended cylinder diamond, like the KS diamonds that I prefer to prepare my teeth with, except that it's a sonic preparation tip. Now there's no safe side on this. It's like a chamfer, so you can use this to finalize your tooth preparations when you're doing a crown or again a veneer and you want to finalize, say, for example, the facial margin. I wouldn't try and complete my entire tooth preparation with these instruments. They're not really designed for gross reduction. They're more designed for refinement, smoothing of your preparations, and preparing in tight areas where you have the safe-sided instrument to avoid nicking or damaging adjacent teeth. Now, as I said, this is from Comet USA, and here's part of the website. And I'll place the links for this also below the videos so that you can easily click on them and look at those. These tips were designed in Italy by Dr. Dominic Masseroni, and he has an excellent book in Quintessence that I bought. I don't know, I bought it 6 or 7 years ago, and he actually uses a similar microscope and magnification systems that I use. And I was really impressed with the smoothness and the quality of his preparations. And part of the trick that he uses, or not trick, but technique and system, is the Sonic Flex scaler with these specialty tips. So I ordered these tips from Comet USA, and they're excellent as well. And you know where they really come in handy is where you have subgingival caries, for example, on a posterior tooth where you're completing a crown prep, but there's subgingival caries. You can go in with this sonic instrument, prepare the subgingival caries, and because it's not a rotary diamond, it doesn't beat up the tissue, the subgingival connective tissue and periodontal tissues, the way that a rotary diamond does. So you have a better result to be able to take the impression that day, if that's in your plan. And if you look at Quintessence Publishing, quintpub.com, they actually, I went and Googled it today just to double check his book, because I bought this book a number of years ago. They have the book on sale right now for $139, which is a great deal. I paid at least twice that for the book, and it's a nice big book. Beautiful photography in this book. If nothing else, download the preview chapter. It's really beautiful. So I would recommend this book as well as the Sonic Flex system and these different tips. If you're interested in this kind of precise tooth preparation technique, and the one thing to keep in mind that's important, you need to use the Sonic Flex scaler, a specific one for the Comet tips. And it's this one here that I've taken the picture of, the 2003L. That apparently is the only one that works with the Comet tips. I'm not sure about the Kevo tips. I would think that the Kevo scaler, all the different Sonic Flex Kevo scalers will work with the different Sonic Flex tips. But I know that the Comet rep told me that I needed to make sure I use these. And I have 2 of these particular 2001Ls in my practice, so it works out well. And I always use them when I'm using the ultrasonic preparation technique. I use them on the 3rd power setting, the highest power setting. You can see here in the video we have this already switched over to number 3. We leave it on 3 essentially. And if you'd like to see a little quick video I shot in my microscope, this is the modified chamfer tip, the Comet tip. And I'm just using it to smooth my margins here on this veneer prep. And if you look at the lateral, the margin's just a little ragged, and I just want to smooth it right up to the tissue. You can see I was touching the tissue there. There was no damage to the tissue. Very little bleeding at all. And these are nice, smooth, fairly conservative chamfer preparations that, you know, we could use a KS0 or a KS1 to complete this. If you do use a KS diamond and you want to get this kind of smooth finish, my recommendation for years has been to use an electric handpiece, and turn down the RPMs about halfway when you're finishing the margins. So the electric handpiece gives you more control over marginal finishing, and then turning down the RPMs about halfway. I turn it down to 10 on my unit, and I just have more control when I'm preparing at that speed and that number of RPMs. And I actually do my marginal finishing. If I'm using a high speed, I complete it dry. But lately I've been, as I said, trying out these new diamonds that I ordered from Comet, these new sonic preparation diamonds, and I'm really happy with the way these work. And just one last photo that I'll share with you. This is the other view of my large operatory. You know, this is where I film a lot of my videos. And I also use my microscope to film the close-up videos like the one that you just were looking at. And I'm using a Pro Ergo microscope from Zeiss. It's a very great automated microscope, so I can change the magnification and fine-tune and focus the microscope just with these little dials here on the handle, and it's bi-handled, so I can use it either handle. I'm left-handed, so I generally use the opposite one that most people use, and it's a great microscope. And then the loops that I use, I'm using 4.5 times Zeiss loops. And that's for all my routine dentistry, and then we use the scope when I want to fine-tune things and just see a little bit better and see a little closer, and videotape. So I use it for example, finishing margins, bonding in veneers, preparing marginal areas in the posterior as well, especially in the back where you can't see. I actually use it for extracting root tips as well. It's amazing how well I can see if I have a broken root tip, how well I can see into the socket with the light and the magnification coming off the microscope. And then I'll maybe do a video of this in the future. I use my piezo system, my piezo surgery touch system, to take out the root tips. It works really well. It's very effective. Nice instrument, but I've just only had that instrument for a few months, so I'll do a video on it at some point in 2014. So those are just some recommendations, a few different products, some magnification products, as well as some conservative microdentistry type of products that I really enjoy having in my practice, and a book recommendation. I would recommend that book. It's beautiful. Beautiful photography and clinical dentistry. So if you have any questions about any of these products, just leave me a question below this video using the comment tags. There's an area where you can ask any questions you'd like, and I'd be glad to answer them below the video. So thank you again, and we'll talk to you soon. Take care.